Hey guys, so these are our last two pathologies we're going to talk about, restricted lung dysfunction and COPD. So starting with restricted lung function, that's exactly what the name implies. The lungs are restricted in their normal capabilities. So something like a stab wound, cancer, lung cancer, Gilligan-Barr, I'm not sure if I said that right. This is my attempt at drawing a knife, which is not that great. But essentially, the lungs aren't able to function as a whole as they would normally be able to. So all of the different volumes in our spirogram are going to be decreased. Symptoms are going to include shortness of breath, difficulty breathing, dry cough, and a lot of times with these patients, they'll look kind of wasting away, like pretty skinny, which is super sad. I don't think there's necessarily a population that this affects more, just because the variety of conditions are so vast. But moving on to COPD, so this just is blockage, meaning we can't get air out of the lungs. So a lot of times what happens, we have three different most common conditions: chronic bronchitis, asthma, and emphysema. Chronic bronchitis is inflammation of the bronchi in the lungs. So I have some pictures here of just the inflammation. Asthma, the tubes, the bronchioles in the lungs are also a little bit inflamed, and they're kind of closing, and there's a lot of excess mucus buildup. Variety of causes for this one. It could be developmental, it could be genetic, it could be just lifestyle related, a lot of different things. Emphysema, that's kind of known as smoker's lung. So huge impact of smoking on the lungs. You're going to have that cough, and it's just, you're going to have difficulty getting air out of the lungs. Also, this is known as barrel chested. So if you remember from our spirogram, the residual volume, so the volume of air that's just left in the lungs that never leaves, slowly, gradually gets bigger and bigger and bigger in COPD. So a lot of times they're just packed full of air. That's where that barrel chested term comes from. Medications, so bronchodilators to try to open up the bronchioles in the lungs, and then also corticosteroids to help reduce the inflammation in the lungs.